Good afternoon. I am Dr. Sukadev. On behalf of RCBC IPS Tamil Nadu, we are conducting this program. I thank our chair, Dr. Sivaraman, for giving me the opportunity to organize the Journal Club meeting for February and March. And I welcome you all the participants, office-based IPS, senior psychiatrists, and postgraduates, and my colleagues and friends. I request Dr. Sivanand Kattimani to welcome and introduce the speaker.
Yeah, okay. Thank you, sir. Thank you for this. This is done under the chapter of Tamil Nadu IPS, and we are happy to have with us a guest speaker, Dr. Swarna Buddha Nayok. So this is every once in every month it happens on 3rd or 4th of Saturday for the newcomers for introduction. So this one we will take one of the journal from the scientist researcher who is working with in the mental health, and then the one article is chosen and then discussed for its how to evaluate and critically evaluate the journal, and then the guest speaker also speaks on one topic of his interest. Now we have selected our esteemed guest who is Dr. Swarna Buddha Nayok, and his topic he will be speaking on culture and psychiatry. The article that we have chosen is from his article related with mental health, and then moon, effect of moon and mental health. So this is going to be discussed by Marcus George, who is a final year postgraduate student of psychiatry in Government Theni Medical College. Before that, let me introduce Swarna Buddha Nayok. He is done his DPM and MD psychiatry, and also completed his PhD in clinical neuroscience at the esteemed NIMHANS Institute. He is currently working as assistant professor, but main focus will be as a clinical scientist, working with the prestigious Center for Brain and Mind Research Center at NIMHANS. He has been member of the Karnataka chapter Indian Psychiatric Society and South Zone, and also the Indian Psychiatric Society. He has spanned around 5 years. Within this span of 5 years, he has published more than 40 indexed publications. And his interest areas include schizophrenia, neuromodulation, culture, and psychiatry. He has collaborated with one of the top of the scientists in the field. So his email is also there if somebody wants to contact and collaborate and ask any doubts during or after the end of this presentation. Now we will move to journal article presentation by Dr. Marcus George. It is moderated by Dr. Vanishri and Dr. S. Shankar. Over to Dr. Marcus George.
Thank you, sir. Good afternoon to all. Good afternoon to all the professors and the postgraduates who have joined in this Zoom meeting. I would like to first of all thank my faculty guide, Professor Dr. John Xavier Sukhdev, sir. And I would like to thank the moderators. I would like to thank also the esteemed guest and the author of this journal, Dr. Swarna Buddha Nayok. Today I will be presenting the journal, Does Lunar Synodic Cycles Affect the Rates of Psychiatric Hospitalization and Sentinel Events? So it was published in the journal, The Chronobiology International, the Journal of Biological and Medical Rhythm Research, in its volume 38. It was published in Jan 2021, and it is having an impact factor of 2.2. The authors of this journal are Dr. Apurva Mittal, Dr. Swarna Buddha Nayok, Dr. Ravindra Nilakanda, Dr. Samir Kumar Praharaj, Dr. Kodila Satya Venkata Narasimha Sharma. So they were from the Department of Psychiatry, Kasturba Medical College, Manipal, Department of Psychiatry, K.S. Hegde Medical College and Hospital. And they were from the Department of Psychiatry, Sri Siddhartha Medical College, Tumkur. So coming to the introduction of the journal, the connection between the moon and human behavior has been there for centuries. The word lunatic comes from the Latin word luna, meaning moon. So the belief of the moon influences mind is not only among the general public, but also strong among health professionals. So the lunar phases are often correlated with human behaviors like aggression, crime, suicide, and other health condition. So people often believe such emergencies tend to cluster around the full moon, new moon, or lunar eclipses. So there is also studies showing there is increase in psychiatric emergencies, aggressiveness, violent behaviors, anxiety, depression, and suicides. So although most of these studies show no significant association, so some of the previous studies which the authors have mentioned are the study done by Kasimi Bajistani et al. He has done a study in around 5,431 participants, and he has found that there is higher amount of psychiatric visits during full moon days, but it was not found to be significant. He has also found that there is a higher severity of illness, which is found in new moon phases. Another study done, Indian study done by Parameshwaran et al. In Goa, he has found that the non-affective psychosis are found more during full moon days. Another study done by Ali and Maharaj et al. They have found that there is higher absconding, which is seen during the full moon phases. Bierman and et al. Has found that there is no association between violence or crime with these moon phases. Another 3 studies have found that there is decreased sleep duration and quality of sleep has been decreasing during these full moon phases. But other 4 studies have found no significance with sleep and moon phases. Calver et al. In around 91 patients and Hicks, Kasky, Porter in around 20 developmentally delayed women has found that the acute behavioral disturbances are increased during full moon phase. Another Indian study by Kakunji et al. He has done a retrospective chart review and a prospective analysis in Manipal. So in around 800 patients, so no significant change was seen between psychiatric behaviors and lunar phases in this particular study. So previous Indian studies addressing correlation between psychiatric exacerbation and lunar phases are very sparse, and they have been inconclusive, which is in sharp contrast to the cultural and religious beliefs of India. So this study was to evaluate the relationship between psychiatric admission rates and occurrence of sentinel events in the psychiatric ward in relation to lunar cycle stage. The aims and objectives of the study are, the objective was to compare the total number of admissions, transference, discharge, and occurrence of sentinel events between the full moon and new moon days versus occurrence of those on control days. Coming to the materials and methods, it was a hospital-based retrospective study done in Kasturba Hospital, a tertiary center in Manipal, Karnataka. Clearance was obtained from Institutional Ethical Committee. All the admissions and transference in the Department of Psychiatry from August 1st, 2016 to July 31st, 2017 were included, and they got a total sample size of 780. Kannada Panchagam calendar was used to obtain specific days. The full moon day included the full moon day Purnami and 1 day before and after it. New moon day included the new moon day Amavasya 1 day before and after it, and it consisted of around 3 to 4 days each month. The control days included 6th, 7th, and 8th day after each full moon and new moon day. It was around 6 to 8 days duration each month. So any behavior requiring physical restraint or chemical restraint in the form of IV, IM, or peroral tablets were recorded. Any escapes, seizures, dystonia, accidents consisting of head injury or fracture, suicide attempts, and death of patients were considered as sentinel events. Study procedure: the inpatient files from the medical records department were reviewed. The socio-demographic detail, psychiatric diagnosis, admission day, discharge day, transferring day, and occurrence and frequency of the use of restraints during the full moon, new moon, and control day of each month were recorded using Performa. The specific dates were provided by the author. Another author, blinded to the full moon, new moon, and control day dates, evaluated the files for required information. Admissions were decided by the consultants, the majority being from the outpatient department and a few from the emergency department. The decision about the application of restraints in consultation with the treating doctors and to the medical package for the social science were with plan-man interval to compare categorical variables. So the results, the social demographic characteristics, the mean age of the patients were 39.4 years. Most of the patients belong to the male gender, around 63.8%. Most of them were belonging to the religion Hindu, around 87.7%. So out of 780 samples taken, most of the patient, around 27.7%, belonged to the schizophrenia spectrum disorder group, followed by bipolar affective disorder and mania, followed by 49% of alcohol dependence and complicated withdrawals. And alcohol dependence complicated withdrawal was around 5.3%. The admission, transference, and discharges on full moon and new moon were compared to control day, and were also compared separately between full moon and control day and new moon and control day, and no significant differences were found. They have also compared the variables between full moon and new moon. Only transference were significantly more frequent on full moon day compared to new moon day. And there was no cases of any escape attempts, occurrence of seizures, accidents, and suicidal attempts. Dystonia was found in 12 patients, of which 4 took place on full moon and new moon days and 8 on control days. There was no significant lunar stage difference. There was 1 seizure on full moon day and control day each, 1 death on full moon and control day each. Thus, these showed no lunar phase association. Applied physical restraints on the full moon was around 27, and in the new moon was around 24. Combined was around 51, and in the control day it was around 45. There was no significant differences according to the lunar stage. But in case of chemical restraints, in full moon it was around 121. In new moon it was around 169. Together it came to be around 290. In control day it was much lesser, that it was 201. So chemical restraint was significantly more frequently used during full moon and new moon days. While taking separately both parenteral chemical restraints and oral restraints, chemical restraints were also significantly more frequent during full moon and new moon days. Finally, while comparing the overall restraint requirements and the frequency of restraint application, both were significantly more frequent during full moon and new moon days. So this was the tabular representation of the results which was set above. So p-value was more significant for the frequency of chemical restraints and overall restraints used, and when comparing full moon, new moon with the control days. Coming to the discussion, done by Kung and Mrazek, they have studied, found that there is increased use of hypnotics on full moon days, and they have found only a weak association. They have also studied the psychiatric emergencies over a 5-year period on full moon days and found no association. Wilkinson, they have found studied this on depression and anxiety and has found no association. To find this effect of religious beliefs on the psychiatric behaviors and lunar phases, they have done studies in Muslim patients in around 62,203 patients, and no associations was found. Calver has done his studies on both prospective and retrospective study and found that sudden behavioral disturbance were increased on full moon days. But he found that alcohol intoxication was found to be the more causal factor for this behavioral disturbance. Where et al. Has done this studies on rapid cycling bipolar mood disorder patient in around 17 patients, and he found an association between periodicity of this disorder and lunar phases. Another study done by Wang et al. In China and another study done by Barr et al. They have found that there is increased severity of schizophrenic symptoms during full moon days. So theory suggests that the nighttime sky of a full moon may be 250-fold brighter than that of a new moon. So it is hypothesized that such a bright sky may lead to sleep disturbance and precipitate manic symptoms. So if this was to be true, symptoms would have been commenced after the conclusion of the full moon night and thus correlated with a later lunar phase. So it is unlikely that moonlight affects a person's sleep in a well-built house, even in the rural settings. Thus, the brightness of the moon affecting the psychological state may not be relevant. So this study found that there is increased use of chemical restraints on the full moon and new moon to be significant only when taken together. So this shows that the brightness of the full moon may not be the exact cause of the exacerbation of the behavioral disturbance. The results may vary based on the definition of the full moon, whether it be a 12-hour model or a 24-hour model or a 3-day duration. So this particular study found significance with a 3-day duration in contrast to Palmer, who found behavioral disturbance were more frequent when the 12-hour or 24-hour model definitions were used. So Owen et al. And Amadio et al., they have studied the association over 4 lunar phases. That is, each phase will be 7 days approximately each, but this will dilute the effect of any lunar effect if present. So in their study also, they have found no effect. So these discrepancies in the findings of the full moon studies may relate to different definitions of full moon. So the date of presentation of the symptoms, particularly in an emergency visits, may not be the exact date of the exacerbation of the symptoms, because patient often take a magic or religious treatment in the beginning. So inpatient evaluation thus gives a better and more accurate observational opportunity than an emergency day visit. So in this particular study, when we see, they have checked that behavioral disturbance in an inpatient setting. So that is one of the strength of the study compared to some other studies who have taken the onset during the admission days. So the exacerbation date would have been much more previous day. So in this particular study, we have found the behavioral disturbance by taking during an inpatient setting. Other hypotheses like biological tide, gravitational pull, and circadian rhythmicity are also proposed by some, but not yet substantiated. So researchers might have initially considered lunar phase as a causal factor because they seem to coincide temporally. Since mental illness doesn't have a definitive biological causes, cultural folklores continue to be viewed as an explanation for these associations. Coming to the conclusion, the use of restraints, especially chemical restraints, and their frequency of use was significantly higher on full moon and new moon days. This suggests that there is increased behavioral disturbance associated with lunar phase. This study adds to this long-standing debate. However, this study hypothesized that cultural context is the foremost reason for this. The biological etiology, if any, remains unknown. The limitation mentioned in the study was it was a retrospective in nature and involved a heterogeneous sample of patients and outcomes. Moreover, severity of illness could not be determined systematically due to lack of uniform assessment of patients. There was also lack of objective uniform criteria to decide who required restraints and their type. Although the Kannada Panchangam calendar is widely followed by most patients from local regions, differences in belief systems are expected. This study did not specifically study the effects of lunar phase on personality disorders, and exclusion of these patients from the sample may have affected the results. Future direction, a large prospective study entailing a socio-demographically homogeneous sample may be attempted in the future. The need for restraints should be objectively assessed with fixed frequency and dosages of chemical restraints. As everyone will not hold the same belief system regarding the effects of the lunar cycle, a prior qualitative assessment of such beliefs may provide more insight. This was a non-funded study, and all the authors declared that they have no conflict of interest. Coming to the critical appraisal of the journal, title and abstract. The title and abstract is clear and indicates the purpose of the study made. Study population, duration of the study, and the relevant findings from the study was mentioned in the abstract. This study addresses a crucial area of research in psychiatry in relations with cultural beliefs about how lunar cycles affect behaviors. As previous Indian studies are very sparse in this particular topic, such a study is very significant, and knowledge from previous literature was mentioned and cited. The objectives and hypotheses are clearly formulated and rationalized. So this materials and methods, this was a retrospective study which was done from medical records for a particular time duration. Such a study is time saving, but there was no follow-up which was done to see if this was a repeated effect. Rather, the results were obtained by a chart review. A longitudinal prospective study would have been more effective to validate better about this lunar phenomenon. There was no specific exclusion or inclusion criteria which was clearly defined while selecting samples. Rather, all the cases for a particular duration was selected, but exclusions of patients was done during analysis. Sample size obtained was not based on any pre-study consideration of statistical power. This convenient sampling may limit the study's ability to generalize the results. Coming to the study procedure, the collection of social demographic details and other relevant findings information was taken from the previous medical records. The location, data collection, and the measures used were explained clearly. The specific dates were blinded to the recorder of details, thereby eliminating the reviewer bias. There could be missing a record bias while recording and interpreting the details. The lack of randomization in the sample can cause biases, limiting the generalizability and to establish the causal relationship. There was no formal uniform assessment of severity of symptoms, and use of restraints was at the discretion of the treating psychiatrist, which would not have been same in all specific dates. This subjective rating can affect the consistency and accuracy. As Indian cultural beliefs is strongly impacted by lunar cycle, for example, all the novels, arts, films, they were all in the background of full moon and new moon, which will influence the public opinion. So reporting and noticing these behavioral changes during these days may be more compared to the other dates. But as this study was in an inpatient setting, it is unlikely that any reporting, all the reporting would have been done correctly. And a 3-day duration criteria was taken representing the lunar phase, but it was not a standardized definition and different studies have taken different durations. As some of the patients were having most of the patients were having alcohol disorders and they would have been in different withdrawal state. So these behavioral changes would be caused due to the withdrawal effect rather than a lunar effect. So maybe this would have acted as a confounding factor because of the substance effect or the withdrawal effect. Statistical analysis, appropriate statistical analysis methods and tests were used for the variables. The results were clearly mentioned and elucidated about the behavioral disturbance and lunar phases. The data was represented in a well-formulated tables with appropriate for easy interpretation. The results were calculated by combining all the psychiatric disorders. So the lunar effective present for any specific disorder couldn't be identified separately. There was exclusion of patients who received restraints on both full moon and new moon days. So there is a loss of good sample which can support the hypothesis when the result of the study itself has showed that lunar effect is a combined effect of full moon and new moon days. But it is clear that the author wanted to find the specific effects of each, either full moon or new moon, with the human behavior. So that's why he might have excluded patients who have been given restraints on both these days. Coming to the discussion begins by summarizing the key findings and emphasize the major findings across various time points. It highlights that there was increased restraints used, that is more behavioral changes, when full moon and new moon days were combined rather than taken individually, in contrast to some of the previous studies. Strength and limitations of the study were addressed. The authors compare their findings with existing literature, citing previous studies on impact on lunar cycles on psychiatric events. Most of the previous studies mentioned that there was no significant correlation between lunar phase and the rate of psychiatric admissions, which was supporting present study. This particular study was confined to a particular tertiary care hospital, questioning the generalizability of the results. This study was a retrospective chart review and not a longitudinal follow-up study, which would have been better to find about the consistency of the results obtained. Thank you.
Good afternoon to all. I'm Dr. Shankar. Thank you, Dr. Marcus George,
Thank you, sir.
for the insightful presentation. To the next segment of our program, where the guest speaker will talk about culture and psychiatry. We look forward to his insights on this important topic. Over to you, sir.
Thank you, sir. Are my slides visible?
Yes, sir. It is.
Okay. Thank you everyone for joining and giving me this opportunity to present one of the first studies that we had done in front of so many people, so many postgraduates and teachers. Thank you for this opportunity, Tamil Nadu chapter IPS. Uh, I am from the last few years, I am in core biological research, but that does not mean that we forget. It's not a schism. It's culture and psychiatry is interlinked so much that nothing more can manipulate psychiatry than culture. So I wanted to show this slide first, that if you just think of a very populated road with a lot of vehicles, it can either be a bad Silk Board Junction sort of thing in Bangalore. Bangalore traffic is horrible. And it can also be an F1 race where there are multiple fast cars going. So it depends on how we understand the situation, how we see our perspectives. Now, we all know about biological, psychological, and social aspects of mental health, and we have been debating whether socio-cultural factors are important. But for mental health, it seems to be so. For example, we always think that the base is biological, and on top of that, there is psychological, and then there is social, which is the final step. It may not be so, because social aspects can be, cultural aspects can be there from before the birth, as just like biology is there from almost before the birth, from the conception, or even more before. Just like that, social factors also matter. I will give you a short example that I keep giving to people, is that suppose all my 14 generations ahead before me had loaded with genes which make me vulnerable towards alcohol substance use disorder. They all have the responsible genes, and it's loaded in my family. And my parents, my grandparents, everyone has ADS, suppose. And I am a person, so that is a biological thing, and I am a person who is very hedonistic, who is very externalizing and have low frustration tolerance, and I quickly either do harmful activities or novelty seeking. So psychologically also I am very disposable to have start alcohol use disorders and start taking drugs, in the common language. But then what happens, I live in Saudi Arabia, and I will never get alcohol use disorders, because society here modulates everything that you had biologically, everything that you had psychologically, but society has modulated that into having an absence of a disorder. We take the opposite example, as there are no vulnerable genes, nothing with alcohol. No one in my 10-kilometer radius drinks alcohol. I'm a very stable personality. I can understand pain, and I'm not externalizing, neither internalizing that much, very stable sort of thing. But I stay in Amsterdam, where most of my friends use some kind of psychedelics or alcohol, and that's we woven in the society. It's not seen bad, it's not seen good, it's just there. Just like we eat breakfast, alcohol is just there. I am quite vulnerable to have alcohol use disorders. So you see how society, how culture trumps over biology and psychology. Nothing else can do that. If I live in Saudi Arabia, if in culture there is no alcohol, no matter how many genes you push in me, I will not start having alcohol use disorder. I may start having opium use disorder. I may start having tobacco, but I will not start having alcohol use disorder. And this power of culture and society is there in no other illnesses, no other medical illnesses or surgical illnesses anywhere other than psychiatry. Culture is the determining factor of illness expression in psychiatry. No matter what stays inside, ultimately what is expressed is through culture. We think that culture shapes every aspect of psychiatric disorders. I will say there is more to it. uh, of course, I'll give example how culture shapes psychiatric disorders. You will also know from your textbooks. But I will say culture shapes every aspect of behavior, not just psychiatric behavior. How I eat food, how I sleep, when do I have fun, when do I sleep, when do I have my tears, all of that depends on culture. We all know that. But is that how culture does it? Culture also shapes not only behavior, it shapes my thoughts. It changes my thoughts as per how I have grown up. So we all know that what is delusion here may not be delusion in a different cultural setting. That specifically says that culture has the power to change your diagnosis from delusion to not delusion. This is not biological, this is not psychological, because thought is same in both ways. But culture shapes the thoughts meaning. So culture shapes every person, not just psychiatric disorders, not who has psychiatric disorders. All of us are shaped by our culture. So naturally, when an illness such as psychiatric disorder comes, which is the expression of we as a person, it becomes a cultural phenomenon. You would have read chapters on culture-bound syndromes. Those were terms given by Britishers and foreigners who saw very different presentations of psychiatry in colonized countries and countries they came to. But that does not mean that culture doesn't play a role in British psychology as well, in British psychiatry, in American psychiatry. So culture shapes every person and therefore shapes every psychiatric disorders. For a few funny examples, suppose symptoms of mental illness can look different according to culture. In West, if you hear voices, it's schizophrenia. In our country, if you hear voices, it's spiritual awakening. I keep telling my patients or my friends that if I hear voices, that's probably schizophrenia. But it depends on my culture, how I believe it, and it's okay to talk to God, but if God talks back, then it becomes schizophrenia in West. Uh, Another factor is like many cultures interpret psychotic symptoms, especially as supernatural events. Sadness, mood symptoms, alcohol use, all neuroticism, all are okay, but it's the psychotic illness that takes the cherry out of it. And there are several explanations. Someone says that you need medicines. Someone says that you need exorcism or at least methi and turmeric. Someone But it's funny that if you have psychotic symptoms or neurotic symptoms, the West may also ask about your childhood, and we may say that pray harder and eat good food. The common controversy that happens is who is right and who is wrong, and is our culture wrong, is their culture right? And the point is that we are all equally right or all equally wrong. It's because what we are doing here is syntonic to our culture. Like in, you have ego dystonic and ego syntonic. In that way we have culture dystonic. So pray harder is a culture syntonic system in us, which gives us peace maybe. In West, if they talk about their childhood, that's their culture and it's syntonic to that. So none of these are right or wrong. They are as per their culture, and therefore they are still practiced. Now think of some culture bound syndromes, like extreme social withdrawal in Japan is common, and it's a cultural syndrome. Extreme outbursts in South Asia has been named as amok. Now if you travel in Bangalore traffic, you will have a amok almost every day, or you will have a hikoki mori after working. So that means that how we react to every day depends on what culture we come from. If I have too much stress, if suppose for stereotypical presentation, suppose if a Gen Z now says that I have too stress and I need a vacation, their bosses will go crazy and they will say we used to work for 90 hours in a week, and you have seen that. In Japan, this will be taken as a very nice thing that he or she is working for so long. In Europe, they will give a vacation. In India, I don't know what will happen. But that, does that mean that my response to stress is dependent on my boss's nationality? What culture my boss comes also influences whether I get a holiday or not, or whether I get a raise or not. So treatment of mental illness depends on what it means to others. It depends culturally. See, if suppose I have a breakup and I am very sad and I am talking to a lot of my friends and younger people, they may really understand me more than if I talk to my parents side, who will say that it's just a breakup, it does, you should not be, you should be strong and you should not be so weak and all that. So it depends on the culture, on the generation, on how we are accepted having mental symptoms or mental illnesses. Now, the question is that has been repeatedly coming in this presentation also. Where do we draw a line? Where do we say that this is all biological, and where do we say this is all cultural? There was an important question, like if the patient family asks that this is full moon related thing, so what should we say? Now, if the patient party is saying that this is this is not psychosis, I know what it is, and it only happens in full moon, then I will more go towards biology and try to make them take medicine from that angle. If something is a cultural phenomenon, if I see that okay, whenever a person has to come to their house in weekends, they become more distressed because they are not okay with their parents, that's more of a cultural familiar precedence. So there is no right answer, and every disorder has its cultural aspects. How to scientifically test this cultural phenomenon is something that we have been trying, and it has been tried before as well. So one of the initial cultural analysis that I have got from this book is that for even for digestive problems, we know how mood changes our digestion, how situation changes our digestion. So early scientists use this type of networking, where they wanted to find out that what causes digestive problems. There is infidelity, there is spirit of father who was upset, there is hard working, there is food poisoning. You will see biopsychosocial modeling in this as well. And this was the initial understanding of research in cultural psychiatry. Then we started understanding that what is neurosis in ICD is anxiety, personality disorder, and depersonalization in psychiatry in Western world, can be dhat, amok, lata, and attack de nervios in African and South Asian. So all of these are not different. They're manifestations of the same core problem. So schizophrenia can be psychosis in some culture, can be emotional in some culture, but we have to understand that can we find out biological markers of schizophrenia sort of thing. We cannot find cultural markers of these disorders. The other understanding is that culture is not just what's happening in the society, it's from our own individual level, then our family, then our neighborhood, then our city. Our culture changes in all these areas. I am a different cultural person in my individual life. In my family, I use some other cultural issues. In my neighborhood, I don't use that. I use something else. When I am talking to you guys as a city or town, I'm using a different cultural tone to it. You all would have come across this beautiful table and concept by Seng, who had worked on cultural issues, and this is something more academic, that how culture or society can influence a disorder. There is pathogenic, pathoselective, pathoelaborative. There are multiple other graphs and tables showing such things. This will be an important exam question as well. If you remember these 6 things, that question for 10 marks is done. What we also be thinking about culture is, okay, what is our past and what is the previous generation telling us. We often forget that culture is what is present. So as you will go to practice as postgraduates, remember what culture you are coming from, in the sense not a heritage culture, but what is your environment, and what environment of people who you are treating are coming from. And it's very important to understand what they think about themselves, and understand their mind through their perspective. Now, specific to this present article, I did not know that how much I have to present about this. Dr. Marcus has done an excellent job. I think there is not much for me to say, but these are newspaper cuttings from very recent newspapers, and that's why I'm saying this is not a village thing. Our Times of India and everyone wants to know. The nation wants to know that what happens on full moon. The moon will turn red today, so is it end of all of us? Does a full moon make people mad? And these are in our newspapers. These are in our newspapers. So Chandra Grahan and all of these things are embedded in our culture like nothing else. In this study, I just wanted to clarify this part, that suppose this 12th is a full moon day, we will, and this black dot on 27th is a no moon or new moon day. Then what we did, some studies took patients only on these days. What we took is one day before and one day after, because a lot of time Amavasya happens on 2 days, 2 nights. Purnima happens on 2.5 nights. So we have taken one day before, one day after, and in between those days we have taken this as a control. It's like your placebo controlled randomized trial sort of thing. So 456 has no, has moon, but it does not have full moon or no moon, so that becomes a control day. I think some one was also asking about theories, and Dr. Marcus has said. I will just quickly say that one of the major leading biological hypotheses was biological tide theory, which says that the moon, through gravity, can pull the water out of oceans and out of our brain also. So chemicals will travel differently, and that's how new moon and full moon matter. But in that sense, we do not know. There has been experiment, and they have shown that the moon's effect on oceans is very different from the moon's effect from the little fluid that we have in our brain compared to oceans. Then there is sleep deprivation. This I do not think is applicable anymore, in the sense that because there is a full moon, there is sleep deprivation. We do not sleep outside anymore. We are almost all used to sleep with bright lights on. Evolutionary. Now, we have evolved from people who lived in forest, who have evolved from fishes who lived in oceans. And in oceans, you need to know about your high tide and low tide, which is dependent on the moon. So biologically, that may be ingrained in our circadian rhythm sort of thing, that we have not yet lost those early genes which can let us know whether the moon is full or not. If we are in the ocean, we can get to know that as fishes, as sea animals. And is that something that has stayed with us, is one of the theories. And then this is the Transylvania effect. It was actually, it's not just Indian, it's not Asian. Whether we think of more developed, less developed countries, every country in the world has their phenomenon with full moon. Any person who, any culture who can look up and see the moon has some statistics with the moon. has some illness associations with the moon. We have Dracula and other things, werewolves and other things in our folklore. So the last part is that we also wanted to check with this article. So when we sent this article to one of the Indian journals initially, it was on a full moon day. It got rejected on not on a full moon day, on a control day sort of thing, on one of the side days. Then what we thought that, okay, full moon has not helped us. Let's do it on a control day. We sent it to another journal and they rejected, saying that they did not say much, but it was again rejected. So we had only one other option left, and we sent this article to an international journal on a new moon day or a no moon day, and it got accepted. So we had our little games in this also. So I can say that I am not superstitious, but maybe I am a little stitious from the office. Thank you.
Yeah, thank you, sir. Just I have one this thing question. Before that, there's a finding biological hypothesis. Recently, I came across that about it is not applicable as everybody sleeps in the city with lights on. It is related to the full moon and the light exposure and reduces the melatonin production delays, and especially they have seen children having hyperactivity or behavior problems, especially on full moon day. I don't know how much is true in all those who are now staying inside the house with the lights on. My question is this. Sorry, I'm sticking back to the old your article because I met you and then Dr. Parmeshwar Ramakrishnan, who did the first study in 1999 in Goa. Does this affect only the hypothetically affect only the patients who are vulnerable, or does it affect the treating team also, mental health professionals' way of handling the patients on new moon and full moon day? Thank you very much.
Thank you, sir. We will have to do a study for that. There has been some study saying that nurses do get affected, and a lot of times there is a subtle. It happens with us also when we know that, oh, Diwali duty is there and there will be more burns and there will be more patients coming on those days. So in that way, some cultural phenomenon do run amongst us also. So if we want to do a prospective study, we have to see the superstitious beliefs of doctors, healthcare, and the patients as well, as you rightly pointed out, sir.
Thank you, sir. It's now time for vote of thanks. I invite Dr. Anbalagan to deliver the vote of thanks.
Thank you, Shankar, sir.
Over to you, sir.
Thank you, sir. On behalf of the Tamil Nadu IPS RCBC committee, I'm here to express the vote of thanks. We thank the guest speaker, Dr. Swarna Nayok, who's actually throwing more light on the influence of celestial bodies on human biological rhythm and as well as their behavior. We are still in a long way to prove the biological link between these two. Hope we do it in future, sir. Thank you very much for your wonderful lecture also, sir. Thank you, sir. And we thank the office bearers of Tamil Nadu IPS chapter and Tamil Nadu IPS chapter RCBC committee, and the article presenter, especially Dr. Marcus George, who presented it very well and answered the questions, many of the questions on the floor. And I also thank the moderator, Dr. Shankar sir, and all the postgraduate students of Tamil Nadu and Pondicherry State who took part in this scientific session with great enthusiasm. And also I'll extend my thanks to East West Pharma for continuously supporting this scientific program to go ahead. Thank you, one and all. Thank you very much. So we call it a day. So thank you, Sugadev.
Thank you very much.
Thank you. Thank you for inviting me. Thank you. Thank you. This was a great opportunity. Thank you. Thank you, Dr. Marcus. Thank you, Sugadev, sir. Thank you.